This is a demonstration of how to use eClinicalWorks physical exam and CPT association function to capture ICD-9 and CPT-2 codes for SummaCare's Tobacco Pay-for-Performance program. I'm going to start by entering any progress note, going to the physical examination section. Next to custom, there is a green arrow for a drop-down box, and I want to select new category. In this instance, we're going to name this category Summa. Now I've already done this, so I'm going to say cancel, but normally you would say OK to this. And in this Summa category, I'm going to go back to my drop-down box and say new item. We'll call this item tobacco use and say OK. I'm going to click on tobacco use and say that I want to update this item. I would like to associate this with an ICD-9 code. The ICD-9 code for tobacco use is 305.1. So I've now associated this with this ICD-9 code. I'm going to now close this window and go to the EMR heading down to Physical Exam CPT Association. Under my new heading of Summa, I go to tobacco use, and I want to associate this with an CPT code. In this case, the code we want to use is the CPT-2 code 1034F. We'll say OK, and we close this. So what I have now is under physical examination, Summa heading, tobacco use. When I enter this field, I've automatically associated an ICD-9 code with it. And as I say OK, whether or not I type anything into this field, it automatically associates now this CPT-2 code. And in the progress note appears the ICD-9 code and the CPT-2 code. Let me give you a real quick real-world example of how this might work. The nurse puts the patient into the room, collects their chief complaint, reviews their medications with them, goes to collect their vital signs, collects indeed their vital signs, and now clicks on the examination button. The nurse then asks the patient, do you smoke? I've created a separate category with all different options available in it, similar to this Summa category. The patient says, I used to smoke, I no longer smoke. So the nurse enters this former cigarette user category. If the documentation is desired in the chart, the nurse can timestamp this, and there's some sort of information there, and say OK, this CPT-2 code is applied. And now, before the physician has ever entered the room, tobacco use has been documented, the ICD-9 code has been listed, and the CPT-2 code has also been applied. Yet another example here. The nurse enters the physical examination section. The person is a cigarette user. And again, this time I will not type anything in here. I'll just simply say OK. I've also, for this one, associated the CPT-2 or the CPT code rather for tobacco counseling. And now the ICD-9 code is there, and the CPT-2 codes are there as well. This should be a quick way of documenting these things. That's obviously very modifiable to however your practice might need it. Thank you for your time.